Good afternoon. Welcome to the St. Clair County EMA briefing here with Chairman Mark Kern. You'll be joined momentarily with Sam Bierman from the Health Department. But first, I want you to pay attention today. We've got quite a few special guests with us today, some professionals that are going to talk to you about the COVID-19. We've got a doctor, we've got a dentist, we've got a hospital representative, and we're going to be talking about test sites. So sit back and relax and suck up all this information because it's going to be beneficial. Sam, more numbers.
More numbers. So as we have done in days past, the numbers that we will report to you today are St. Clair County residents that have been tested. As of today, we are at 2,122 residents that have been tested. 496 have a positive test result, which is an increase of 14 from yesterday. And that includes both males and females from their 30s up to their 90s. We are at 1,571 negative test results, with 55 test results still pending. And as we did yesterday, I have some sad news to report again today. We do have 2 additional deaths, bringing our total up to 39. And both of those were females in their 80s who did have underlying health conditions. And as always, our thoughts and prayers go out to the families of the loved ones who have been taken by coronavirus. For state totals, we are at 284,688 that have been tested, with 56,055 positive test results, which is an increase of 3,137 from yesterday. We are at 2,457 deaths for the state, which is an increase of 102, and our condolences go out to those families as well. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we currently have 49 patients that are admitted due to COVID-related reasons, and 6 of those patients are currently on ventilators. For long-term care facilities that are currently in outbreak status, and that means 2 or more staff or residents that are either COVID positive or who have COVID symptoms, Berea of Belleville has 12 positive cases and 2 deaths. Colonnade of O'Fallon has 2 positive cases and no deaths. Four Fountains in Belleville has 53 positive cases and 6 deaths. Memorial Care Center in Belleville has 43 positive cases and 5 deaths. St. Paul's Home in Belleville has 5 cases and no deaths. And Lebanon Care Center in Lebanon has 21 cases and 2 deaths. And as I'm sure most of you are all aware, today, with it being May 1st, the governor's executive order has gone into effect, which means that if you are unable to keep 6 feet of social distance between you and someone else, you should have a mask with you at all times to be able to put that mask on. Some stores are going to be requiring you to wear a mask into their facility, so it's best you always have one with you. Even if you think you can keep 6 feet of distance between you and someone else in a specific store, the store may have policy and procedure that you have to have a mask going into the store no matter what. And as we have done before, I had my handy dandy CPR mannequin here. And just to go over a few reminders with you when you are wearing a mask. When you wear a mask, you want to make sure that it completely covers your nose and comes all the way underneath your chin. Wearing a mask that is just covering your mouth and exposing your nose, or vice versa, that is covering your nose and not your mouth, doesn't do any good. And when you take the mask off, always remember that you have to assume the outside is dirty or contaminated. So when you take it off, you want to fold the outside together. So you're keeping the dirty surfaces off of your hands and off of your face as to not contaminate those surfaces. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we've got a lot on our program today, but I would like to say we always look for a little good news. Today, Sam's numbers reported 49 people hospitalized. That's the first time, I believe, that this number has fallen below 50 since April 15th. So staying at home, staying in place, washing your hands, doing all this. If you think about this, we've been on this since before St. Patrick's Day, around March 14th. And just at this point, we're finally to the level where we were April 15th. don't take our foot off the gas. Let's keep going. Let's keep doing all the things that we've been talking about, and we'll be able to get those numbers even lower. The last thing we want is to see things start to rise again, because then it's just going to take that much longer to get rid of COVID-19 in our community. One of the chief reasons that we are able to get rid of COVID-19 is because our hospitals are doing such a great job. And today we're joined by Dr. Peyton McGowan. Peyton is the hospitalist medical director at HSHS St. Elizabeth's Hospital. Welcome.
Thank you for having me.
Thanks for being here. So let's just talk about St. Elizabeth's a little bit and what's going on. As a hospitalist, what's a normal day for your team?
So a hospitalist is usually a family practice or internal medicine trained physician that takes care of patients from their admission to the hospital to the time that they're discharged. We help communicate with specialists, coordinate care, and get patients handed off safely to their primary doctor. So things have looked a lot different in the last 6 to 8 weeks than they had before. Some precautions that we're taking is we're assigning all of the COVID patients to one physician. That way it minimizes our PPE utilization and also minimizes exposure to providers. So that's one big change that we've had. For me as the medical director, I've been able to be a part of the COVID task force at St. Elizabeth's and really work closely with our hospital administration to be on the front lines representing providers so that we can do everything to help the hospital and they can give us everything that we need to safely take care of patients.
So because a lot of people fear hospitalization, if someone tests positive for COVID-19, are they directly admitted to the hospital?
No, not necessarily. So just like with any other illness, if you have the flu, if you have pneumonia, bronchitis, unless you need hospitalization for oxygen or any higher level of care, those are the reasons that you get hospitalized. If you're young and healthy or have a mild case, aren't needing oxygen, you can safely shelter at home and isolate at home.
So as part of your duties in the past, you had a lot of people come in that needed elective surgery. Something may be wrong, but wasn't an immediate emergency to get it taken care of. Are those elective surgeries now starting to come back?
So not quite yet. We are in the process of restarting elective surgeries around the second week of May. And there's quite a stringent list that the patients have to meet and cases have to meet to do elective surgeries. So just like it took us several weeks to get to our peak, it's going to take us several weeks to back out of that and safely allow patients and elective surgeries to start again. So we have a protocol for how we're going to start elective surgeries again the second week of May.
So, and that leads into to really an important point. So we see some areas starting to loosen up. They're letting people to go out and get together and congregate. In some ways, they're not even perhaps talking about social distancing anymore. The president removed those guidelines. Let's talk about non-symptomatic patients, people who, is it possible to have COVID-19 and not know it?
It is. So there are those asymptomatic carriers out there that might be shedding the disease when they cough or breathe or come within 6 feet of you, and they don't have symptoms. So they don't know that they have COVID-19, which are arguably the most dangerous of the population of patients with COVID because they don't know that they're giving it to their family members and people that they come into contact with.
So they feel great, and they're out, and they're saying, well, I feel good, and it's only my health I need to worry about. But that isn't really the case. There are more people than just them.
Right. If you think about every person you come into contact with and then every person they come into contact with and it just goes out exponentially, it's really those people that we need to worry about, the ones that are at a higher risk.
And then beyond that, if you're going out and you're non-symptomatic and you give it to someone else, you're putting a doctor, you're putting a nurse, you're putting hospital staff at risk.
Right. This is the most important time we can urge people to continue to do the simple things. Wash your hands, stay at home, only come out for essential activities, and when you do come out, follow the guidelines of wearing a mask and staying 6 feet away from everyone.
Because COVID-19 affects a lot more people than just you.
It does, and it's not over. I mean, it's very encouraging that we're starting to see some numbers plateau, but we are in no way close to the end of this.
So tell us about the team at St. Elizabeth's that you run with. Are they exhausted? Is this can they sustain the pace that they've been going at for an additional 5 weeks?
So we're doing pretty well, all things considered, and I can't say enough kudos to our nursing colleagues, ancillary staff, and our administrative team that's been there to support us, and pretty much everything that we've asked for, they've done their best to try to deliver, and have really come together around this epidemic. Again, like I said earlier, we're having only one doctor come into contact with these COVID patients once they're admitted, and really minimizing that. So if you are the COVID person for the day, it can be taxing. I've done that, and it's difficult, but you know that you're protecting your teammates, and everyone's taking their turn doing that, and we're taking all the precautions that we can to keep everyone safe.
Are all of the restrictions that have been in place still in place? So no visitors, restrictions on emergency room, and do you get screened outside the hospital?
We do. So there's only two entrances. There's a physician entrance and employee entrance, and then the ER is where all patients have to come in. Everyone gets screened at the door. We get a new sticker every day saying that we didn't have a fever when we came in, and you have to do that every time you come into the hospital in the morning. The same precautions are there for no visitors, with the exception of end of life. So we've had a few patients who are actively passing away, and we allow a family member to come in and be with them.
Even if they have COVID-19?
With a few, we have, yes, and that that they understand the risk, but that's their loved one that they want to see.
Right, and that's compassionate. We understand that. Is there anything else that you'd like to kind of address or tell people, just to make sure that everybody has the full picture right now?
Sure. So two things. One, St. Elizabeth's is open for any and all emergency or any and all ailments. So if you're having signs and symptoms of chest pain, stroke, any acute illness, please don't hesitate to come in. We've seen decrease in our numbers of admissions for heart attacks and strokes, and unfortunately that means people are probably suffering with these at home. So don't neglect your health. If you have an emergency condition, please call 911 or come into the emergency department. And then the second thing is just to thank all of you guys for your continued dedication and updating the public every day. We really appreciate it.
Well, we appreciate you. Full recovery is really only possible most times if you go to the hospital and you get medical treatment.
Right.
So people need to know to do that.
That's right.
Herb Simmons?
Doctor, thanks for coming in.
Thank
Just
you.
one question. Do you get a lot of questions from the public or your friends? When is this going to end, and why can't we go out and do what we're doing? We field a lot of these questions on our briefings, and people are saying it's fake, there's nothing more, it's the flu. What's your response to that when you hear that?
Sure. So, again, it's encouraging that we're seeing a plateau here, but just as it took weeks to get to that, it's going to take us weeks to get back down. And the only reason that we've been able to come to a plateau is by social distancing and wearing masks, hand hygiene, everything that we've all been doing. And I know everyone's getting antsy, but go in your yard and enjoy the weather, but try not to come into contact with friends or family. It's not worth it right now, not yet.
I think that sums it up.
And isn't the problem such that people sitting on their couch or working in the garden, you don't really think you're doing anything to help your community, but
Right.
You're doing the ultimate. You're by sacrificing that, going out in public, you're really helping. It's for the greater good.
Absolutely. It's much more than one person.
Thank you, Doctor. We appreciate
Doctor,
you coming
we appreciate you
Thank
being
you.
here today. Thank you. Thanks for your service.
Yes, thanks for having me.
So, now it's time for the zip code report. Everybody thought I was going to forget that. Today we don't have any new zip codes, but we have increases in many zip codes. 62201, we now have 11. That is an increase of 1. 62203, we have 17. 62204, we now have 20. That's an increase of 1. 62205, we have 18. That is an increase of 1. 62206, we have 46. That is an increase of 4. 62207, we have 26. 62208, we remain at 34. 62220, we have 50. That is an increase of 2. 62221, we have 40. That is an increase of 2. 62223, we have 31. That is an increase of 1. 62226, we have 70. That is an increase of 1. 62232, we remain at 6. 62239, we have 8. That is an increase of 2. 62254, we now have 14. That is an increase of 1. 62257, we have 6. 62258, we have 13. 62269, we now have 43 COVID positive patients. That is an increase of 1. And in zip code 62285, we remain static at 6. Remember, if you don't hear your zip code here, or if there's a zip code not mentioned, it's because they haven't risen to the level of 5 yet, or get to that point of 6. So we thank you for listening to those. And remember, just because it isn't in your zip code doesn't mean that you're safe by walking outside and not doing the appropriate masking and staying 6 feet away from people. All it means is, number one, you may not have risen to that level yet, and also this virus is all over the county. It really doesn't discriminate by zip code. So during these times, services have been altered. Many people's lives have changed, and certainly dentistry is something that many people have inquired and said, how is that working? Is it safe to go into the dentist? Or is my dentist performing all of the services that we normally can rely on? And today we've got a prominent dentist in our community, Dr. Randall Markarian, and he's here to talk to us about how things are working in the dentist world today.
Thanks for having me here today.
Well, thanks for coming today. So let's just dig right into it. During this time, is elective dentistry work being done or not? And if dentistry work is required, what additional guidelines and things are you putting in place?
Sure. So right now, based on, number one, the Illinois Department of Public Health's order, as well as a recommendation from the American Dental Association and the CDC, is that only emergency procedures and urgent procedures should be done in the dental office right now. The reason for that is to help conserve PPE so that can go to necessary hospitals rather than being used on elective procedures in dental offices. And part of that is because the nature of dentistry working in a patient's mouth creates an aerosol of the virus particles, which could lead to increased risk. So right now, the recommendation is emergency procedures only, and most dentists are in their offices treating emergency patients as they come up. So people should, if they have tooth pain or a need that they are not certain of, they should call their dentist. They would be pre-screened to see if they rise to the emergency level. There would also be a screening to see if there were any risk factors that they maybe have been exposed to the COVID-19 virus. And then upon reaching the office, they would get their temperature taken, probably further screening. We are using hydrogen peroxide mouth rinses to help decrease the amount of virus in their saliva and in their mouth. So when we're working on them, it decreases the risk. And when patients go to the office, they're probably going to notice that the dentist's office is looking a little different with more partitions, and it's going to be a little different experience than what they had before.
So the guidance we've heard about since the beginning is that this is a virus that spreads by droplets. Mm-hmm. And there's probably no more droplets around that occur during dental work.
That's true.
The danger is a lot to you as a dentist who's maybe have to drill or get in someone's mouth. How are you protecting yourself, or at least what is the best way to protect yourself? And really, is that you have a risk no matter what you do?
Right. So in order for dentists to work on patients where they're generating aerosol, where they're drilling on teeth, they would be required to wear the same protective gear that you're going to see from the physicians at the hospital that are treating COVID-19 patients. N95 level masks, eye protection, face shields, disposable gowns, in order to protect them, serve as a barrier, not just for the dentist, but for all of our staff as well. So people are used to seeing their dentist and their dental hygienist and the dental assistants wearing a surgical style mask and probably glasses, and now they're going to see a whole nother step above that in infection control with the higher level masks and face shields.
So do you have any recommendations for patients out there? I mean, they're not going to get their teeth cleaning. They're going to just have to hold off on that. Recommendations for people if they got tooth pain, what to do?
I mean, the first thing, if you have tooth pain, call your dentist. Talk to them. Again, they can do some pre-screening to determine if it's something that you need to come in for. Some of the recommendations, brush and floss so that your dental disease doesn't get any worse. But also, just know that when it is appropriate, dentists will start to see more and more procedures beyond just emergencies. Somewhere between elective and emergency procedures, hopefully we'll be seen here in the next few weeks as dentists' offices start to prepare for the higher level of infection control. So we don't want to see the dental disease progress, but we do want to be safe and make sure that we are, again, conserving the PPE, but also protecting patients and doctor and staff in the dental setting.
But until there's a vaccine, you're really not going to be able to protect you or your staff 100%.
True. We are waiting to see the curve flatten further. And at that point, again, dental offices will be reconfigured, seeing much lower volume of patients to make sure that we can maintain social distancing, to make sure that we can maintain the high level of infection control that's necessary for this virus. And it is going to change things. So there may be a bit of a delay for people to get into their dentist even once some of the restrictions have been lifted because of the changes that are necessary to make sure that the patient, the doctor, and the staff are all safe, or as safe as can be.
So do you think that when dentistry reopens, that every office will open about the same time, or do you think there may be some differences between the way dentists treat the guidance that they're getting from the ADA?
I think it will be an individual decision by the dentist and based on their professional judgment and as to how they open. Certainly, I think it's going to be a staged opening in all offices with seeing a minimal number of patients and gradually ramping up as new infection control procedures are put in place and to determine what is the appropriate way to handle it.
So we're right across the river from Missouri.
Mm-hmm.
Are they? Is it looser over? I mean, they're going to let people do open a lot of the social activities that they were used to. Is dentistry opening up in Missouri as opposed to Illinois?
Dentistry is going to start opening up in Missouri, and it has in other states as well. It is certainly a state-by-state decision, and it is the best science hopefully being used for each individual state and their current condition.
So we hope that whatever the decision is, it's guided by medicine.
Correct.
Guided by science.
Correct.
So we appreciate you being here, Herb.
Hi, Doc. Thanks for coming in. As the chairman said, we'd received several inquiries from our followers that, we'd like to hear from the dentistry. So we're glad you was able to come in and work us in your schedule.
Thank you for having me.
Thank you very much. Appreciate
Thanks,
it.
Doctor, very
Take
much.
care.
Thank you.
Okay, so moving ahead with the program today, we're fortunate that, as we said, testing. That's really been the word of the week and for the past couple weeks. And leading in the number of testing sites in the area is Southern Illinois Healthcare Foundation, which runs Touche Regional Hospital, and today we're joined by Jay Wilshire, who is the president of Touche Regional Hospital. Touche, I'm having trouble. I need the dentist to come back.
Yeah.
Jay, welcome.
Thank you. Thank you for having us. We appreciate being here.
So tell us, how are things going at Touche right now?
They're going well. It's a very interesting time, as we all know, and I think one of the most difficult things for the staff and for the patients in the community is who knows when it's going to be over. And what we're doing is we're trying to talk about the new normal. What's it going to be like in the future to stay safe? And we're trying to focus on that, and we're spending a lot of time communicating with the staff. I believe the morale is high, and everybody wants to do the right thing.
So you are testing. Can you
Yes.
talk a little bit about testing and how that's going, some of the numbers, some of the requirements?
Right. So one of the challenges with testing has been getting the right equipment, and one thing about COVID is that things change very rapidly. The science is changing, the availability of the equipment is changing, and it's all getting better. Through Southern Illinois Healthcare Foundation, we're doing several sites, so several drive-up sites. And it's all just ramping up. Alex has the actual numbers. We opened a site today, and we're finding about 15% of positives are coming back. But again, things are improving every day. A few weeks ago, we had to wait several days to get a result for somebody that may be in the hospital, where now the labs are ramping up, everything is getting better. You mentioned earlier, we need a vaccine for this to be over. We need more testing, because the more we know about the population, the more we're going to be able to flatten the curve.
Does that 15% positive mean that 15% of the people out there may have COVID-19? Many of those might not know they have it.
Well, the asymptomatic aspect of this is what really makes it the invisible enemy. So, I'm not going to commit to that exact number, but yes, that is a problem and a challenge out there, because in the past, when people were sick, they stayed home. We don't know, and that's what makes this really tough on everybody, including our businesses, which you were just speaking of.
And the testing requirements have loosened up quite a bit. So
Right.
I guess what the question I should have asked is, are non-symptomatic people can be tested?
Right.
There's a whole host of reasons to be tested, and symptoms isn't a requirement to get that test. So there are people who could be testing that don't feel bad that come back positive.
Exactly. We're going with what the government and what the governor is saying in Illinois on the standard guidelines. But as you probably heard this morning, I think they want everybody in LA to be tested, and there's 4 million people. I think we're going to see mass testing in the future, but we're waiting for the appropriate guidelines, recommendations, plus we have to have the equipment. And it's the lab machines to test it, it's the swabs, it's the PPE for the people doing it. There's many things involved.
So what's the turnaround time for a test at Touche or Southern Illinois Healthcare?
Right now, it can be just a day or two, but at one point it was up to a couple of weeks. It kind of depends on the labs. One of the things that just has come out is the point of service testing, where you get a very rapid turnaround. So it varies depending on the lab, the equipment, and so forth.
So this is really evolution that you're seeing in testing. So it started out a couple weeks to get a test back. Now you're at 1 or 2 days.
Mm-hmm.
Is in the future, is there another machine that you're going to maybe be acquiring that'll help you to get rapid testing?
Let's hope. Yeah, there are some out there, and that is the hope, to have a very quick turnaround. Right now, when somebody is symptomatic and they present to our emergency room, they may be admitted under what we call a PUI, or a patient under investigation, and we would treat them as if they had COVID until the test came back.
And they would be in your hospital at the time, or you would have them go home and shelter in place? How does that work?
If they met the criteria for hospitalization, yes.
And what's the criteria? So if you got 103 temperature and you're coughing but
Right.
you're not experiencing the shortness of breath, are those people sent home, or?
Well, it would be based on the emergency room's physician assessment, and if they needed oxygen, or if they needed further care or medication or IV therapy or those types of things that they were unable to get at home. That is what would meet the criteria for hospitalization.
Okay. Any recommendations, as a member of the medical community, and you run a hospital,
Right.
what would you tell the public out there that maybe isn't quite buying into the fact that they need to stay home this weekend?
Right. Following the rules has helped. You've had a lot of discussions on this program about flattening the curve. There's a lot of science and data that shows that it's working. I think one of the really key points is, as we see things incrementally open up, remain safe. So follow the 6-foot rule, follow the PPE. Just because somebody says you can do something doesn't mean you have to. So stay safe and follow those very basic rules that, through public education and the media and everybody knows them. So follow them.
So just because things are opening up in Missouri doesn't mean you have to go over and try them out.
follow the rules for safety. One thing about this disease is it can be brutal to the very healthy, and we've seen that in all of these deaths. This isn't just something that affects the elderly. You don't know how it's going to affect you, and that's another mystery. So follow the rules.
And there's no readily available cure, or even a cure at all, that it has been approved, and certainly no vaccine. So if this spikes again, if opening up causes a resurgence,
Right.
we're going to be back where we are, just trying to learn with
Right.
every day.
Exactly.
Herb?
Great information. We really appreciate you coming in, Jay. I know you brought another guest with you that's going to have some information on the testing sites that I know some
Right.
of our followers are really wanting to hear about.
Yeah, Alex is an expert in those sites, and he helps set them up. So
Very good. We're going to get him on next, and then
Okay.
I'm sure some of the followers are going to want to know about the testing. Thanks, Jay.
Great. So as we heard, Alex Lovshin, I think I got that right.
That's correct.
He's the Vice President of Ambulatory.
Ambulatory.
Yeah.
I need that dentist. Where's Dr. Markarian? He left. Ambulatory Networking Services with Southern Illinois Healthcare Foundation and Touche Regional Hospital. So, Alex, let's just expand a little bit. I think it's interesting, and I'm sure Herb set it up this way, but we started with St. Elizabeth's, HSHS. We next went to Touche, and now that's you. And then in a couple minutes, we're going to be talking to a representative of Walgreens who has a new testing site opening up. All three have different tests that they're giving at their sites. One, it's at St. Elizabeth's HSHS, is a long instrument that goes up your nose and kind of goes back in your nasal cavity. And that's a quick test, we were assured. Your test is a throat swab.
Correct.
And Walgreens is a nasal swab, but it only kind of goes up inside the nose like a flu test. So can you talk about maybe the differences in testing and why people get one and not the other, or why is it just based on where they go, or is it based on their need?
Great question. In reality, it has a lot to do with the equipment that's being developed and being used. This is a new virus that we haven't ever incurred before, and we didn't have any testing that would be able to identify this virus. So as different partners have developed new testing platforms, they've based it on different types of swabs and different types of collection. So that really just, the different options really are just dependent on what equipment each different facility is using.
So if you go to Southern Illinois locations, of which you have many, or to Walgreens, you're going to be tested, and you will know whether you have the virus currently.
Correct. The test that we are running is a diagnostic test, and it will indicate whether you have active virus in your body at the time.
But your test doesn't say if you have a level of immunity or if you had it in the past. If you've recovered, it won't show up on your test or Walgreens test. Is that correct?
I can't speak for Walgreens, but for our testing,
We'll ask Walgreens.
for our testing, it is diagnostic only in identifying if the virus is currently active in your body.
And I guess that's the reason for the hospital's test just seems to be a little more onerous and requires the special testing labs to be able to test that. So how long does it take for a patient to get back a test, and are they notified? How are they notified? What's the process?
So our process is a couple steps. We start with a telephone phone screen with a nurse practitioner, part of our SIHF healthcare family. If anyone wants to get screened, they can call 618-646-2596. We'll do a phone screen with you. They'll review symptoms, possible exposure, work history, some factors, do some patient education. If they feel that you're a good fit for a test, they'll direct you to one of our 5 testing locations. We are collecting Monday through Friday in the afternoons. The test is a simple throat swab. It's done while you're in your car, and we're getting results back in 24 to 48 hours.
And you have the capacity to test more?
Yes, we do.
And how many do you test at all of the sites a day approximately
We've been running probably this week anywhere from 75 to 100
per day?
per day.
Well, that's it's helping.
Every little bit's helping, and today was the fifth location we've opened in the past 2 weeks. So we are definitely in a ramping up phase and adding providers, adding staff as the need goes.
And do you know a maximum capacity?
We were sort of estimating we could probably do 50-ish for each testing site each day. But if the need is there, we can definitely expand that.
So that's 250 at least, or
Correct.
more a day. And
Correct.
so you're expanding based on the need.
Correct, and we are looking at some additional sites in the coming weeks as well.
Well, we appreciate your work during this time. Testing is key. The ball is kind of being put in your court now to make sure that we try to slow the growth of this virus. Herb?
Going to dig a little bit deeper.
Yes.
I go to one of your testing sites.
Yes, sir.
I get the test done. The report comes back, it's positive. Who gets notified, and privacy is all well protected?
Yes, it is. The first step will be having one of our providers contact you as the patient. They will review the results of the test, give you patient education, give you guidance on what to do, and maybe when, if necessary, you should seek higher care at your doctor or at a hospital. We then will be reporting all of the results as required to the local health departments so that they can maintain the statistics that you guys report every day.
Very good. Appreciate that. Thank you very much.
My pleasure.
Thank
Thanks,
you.
Alex.
Yep,
Thanks
thank
for
you.
being here. So we've already disclosed the next special guest that we have today, and Julie Bickers is with us. Julie is representing Walgreens, and Walgreens is going to be starting testing in Cahokia, it's my understanding. So welcome.
Yes,
welcome,
thank you.
Julie. Thank you
Thank you.
for being here.
Absolutely.
So when are you going to start doing this, and how are people going to be able to access your testing?
Oh, perfect. So we started today, this morning at 9 o'clock. So they'll be able to come to the Cahokia store location. We'll be offering the rapid testing kit that you talked about, so the nasal swab. Our pharmacists are going to oversee that. The Cahokia store will have it in their parking lot 9 a.m. to 5 p.m. 7 days a week. It's a free test, and you have to be 18 or older in order to have it. You can access it a couple different ways. You can either make an appointment, and you would go to walgreens.com/coronavirus, and there's a screening process that you could go through to set up an appointment. But we are also allowing people to drive in as well, so you don't have to have an appointment. It's 18 and older. You can have symptoms or be asymptomatic. When you arrive, we'll do a screening process, check you in, and then our pharmacist will talk you through the self-administration and oversee that process with you to make sure that you're able to do it appropriately. They'll then counsel you to let you know how to shelter in place until you get your results. And then the results usually come in about 24 to 48 hours. And then we will call each person individually, like the former guest said, and talk them through what steps to take if their symptoms do or don't get better. We'll report the results to them, and then also we'll report to the public health departments as required.
What's the address of your store?
It is on Camp Jackson Road in
1201 Camp
1201 Camp Jackson Road in Cahokia, Illinois.
So because I'm greatly interested in the process. You actually took this test.
Mm-hmm.
So maybe just describe what a person has to look forward to when they come and see you. And are you the one that administers, or you have someone there that does it?
Sure. So we have a team of pharmacists and technicians. So you'll be checked in by a technician who will sort of get your paperwork, do your pre-screening process at the first station. Then they'll have you pull forward, and you'll stay in your car. And we do have our team members stay 6 foot back, and they have personal protective equipment on as well. And they will talk you through the process, and we keep your window up and down based upon where you are at in the process. The pharmacist will then watch you through your window to make sure that you do this process appropriately, but you'll have a swab that you'll insert about 1 inch up into your nostril. You'll rotate it 5 times and then do it again in the other nostril, and then you'll put it back into the sleeve, and the pharmacist will instruct you with the rest of the process as you go.
And the result that comes back will say you have COVID-19 now or you don't. That's
Correct.
really the result of that test.
Yes, it's not an antibody test, so it doesn't tell if you've had it in the past. It tells if you have an active infection right now.
And so I know Walgreens, for-profit company, and people go there and buy their medicines, but this test is free?
This test is free of charge. Yep.
And if people have insurance, you ask them about it, but if they don't, it doesn't matter.
We are not. So we've been working with the government on this, and we are offering free of charge testing for people at this time.
Well, that's great.
That's great. It's a win-win, I think.
And you report your numbers to the health department?
We do. Mhm.
To Eastside Health District if
Yes,
they're living in Eastside Health
correct.
District.
Yes, yes.
Okay, so just to make it clear,
Sure.
you can call.
You can call.
And what number can they call?
No, you can go to
online?
walgreens.com/coronavirus. If you have the Walgreens app, you can go to the Find Care Now and also do the screening and book an appointment. And if you don't have either of those and you just want to come to the store, we can do a pre-screening there.
And it's set up, Kelly told me yesterday that it's through the drive-through.
It is.
Yeah, so
Yes.
to pick up prescriptions or something like that.
Yes, we've closed down the drive-through because we did have to put a lab in there. So we are offering some curbside options for that. So if you are sick, we're asking you don't go into the store. We have set up some curbside options for patients who are testing that can go to the curbside and we can service them that way.
So this is basically a self-administered test, as you said. The pharmacist oversees it, but you stay in your car.
Yes.
You do it, and then get your results back.
Yes.
Sounds painless.
Sounds painless. And you can be if you can be tested more than once.
If you needed to be tested more than once, you could. Yes.
I mean, because this is a thing where a person is taking themselves there. So if they came in there on Monday and they started to think maybe on Thursday they ran into somebody, they could come back and
They could.
take
Yes.
advantage of it.
I think one of the things that we have to consider is, the access to the testing and supply versus demand. And at this time, the supply is pretty good for what we have right now. So I say that, yes, you can.
Now.
Nobody knows the future, so.
No. Julie,
Very good. I'm done.
yes, we appreciate you. Julie's a pharmacist, by the way.
I
I
am,
just
yes.
kind of introduce you, and I don't say how well qualified you were to be here, but you are, and we appreciate your service because you're out there dealing with people too, and we rely on our pharmacists for a lot of other needs than just COVID-19.
Well, thank you for having me.
Very good. Thank you very much.
Thank you.
And I told you it was going to be a day of a lot of information, and we appreciate you staying with us. And for those of you who join us later on this evening and review this, but a few things I want to go over just to reiterate as you hear every day. And you've heard this thing is changing by the minute. And when I say by the minute, just as we got ready, the chairman had just got started, and we were notified of another death in the county. So it's changing that quickly. You saw the numbers, I heard the numbers that Sam gave you statewide, 3,137 new cases over a one-day period. 103 now that we know of from yesterday. So these numbers are here. They continue to rise. And all we can say is stay home and stay alive. We'll be back tomorrow afternoon around 3:30 with the next briefing. And we'll be back shortly with Cindy to translate this to our Spanish community. Thank you.